Good morning, I'm Amy Fenning. I'm a nurse practitioner student at Maryville University, and I'm here to perform my assessments on the head, eyes, ears, nose, and throat. This is my patient Patrick. I'll be performing a variety of testing today, okay? Any questions? Are full, hair goes past the outer canthus, and it doesn't appear that there's any lesions there. Patrick, can you open your eyes real wide for me? Great, and close your eyes. They close symmetrically. He doesn't have any crustaceans or sparseness to, I'm sorry about that, buddy, sparseness to his eyelashes. All appears to be well. I'm gonna touch your face. I'm gonna pull down your lower lid, Patrick, if you can just look right at me, and I just wanna take a peek at what we call your conjunctiva, and that appears to be normal pinkness, and your sclera, which is the white part around your eyes, is nice and yellow. Nice and white. I don't want to see any yellowness to that, okay? And I'm going to take a peek at your, just at how your pupils react to light. And I'm going to look for pupillary reaction with this light, and your pupil shrinks nicely. And I will do that on the other side. Now what I want to do is essentially the same thing, but I'm going to be looking at your opposite eye to make sure your pupils react as well. And the second time around they do. Excellent. Right. What I'm going to do next is ask you to, I'm going to look at your six cardinal views of your gaze. So if you can just follow my finger with your eyes only, not your head. We'll start in the midline. We're going to go over, up, down, back to anterior and midline, and then I'm going to do the same thing over this way. Over, up, down, back to midline. Excellent. Now I want you to follow my finger. I'm going to get kind of close to your nose. I want to see how your eyes react to getting close in, and your convergence is just fine. Thank you very much. Next, I'm going to look into your eye, which may be a little weird for you because I will be getting fairly close to your face, but what I'm looking for is that your pupil has something called a red reflex. I will then look beyond the red reflex into your eye, actually, and look at your optic vasculature of your eye, the optic disc, and see that everything's healthy in there. Okay, so if you can scooch out just a bit here, I'm going to use my right hand to look at your right eye, so I will be on the right side of you. I'll have the camera come in this way. And if you can just focus on an area right over my shoulder, Patrick. Can you see?
Get on.
Get on this side. Okay. So you'll feel me coming in. I'll use my right eye, and I will be coming in closely to you, Patrick. Okay, I visualize the red reflex. It's right there. It's more orangish in color. And as I come in, buddy, I want to see, I can see the cup, and I want to look towards the nasal aspect, down and up, and I can see the vessels. And again, a little close, sorry bud, down and up. And I will follow that same process on the other side. Next, we'll move on to just taking a peek at your nose. What I'm going to do is just quickly take a peek in your nares, which is the opening to your nose passage. Look for something called your turbinates. Look at the color of the mucosa. Make sure there's not any obstruction or lesion there. I also want to look at the septum in between your nasal passages, okay? All right, I'm going to have you tilt your head back slightly. I'm going to put my finger on your nose just to lift up, and I'm just going to look. And you do have a very large turbinate in there on your left side. Kind of a reddish color of the nasal mucosa. There's some clear nasal discharge, and the septum appears to be intact. That's good. Great. Next thing we're going to do, Patrick, is I just want to feel your face. Do you have, and I want to touch your sinuses. Any problems there? No edema? Does it hurt at all up above your, okay, great. We're going to move on to the examination of your ears. I'm just going to start with looking at the exterior of your ear. If you can take a peek, the auricle and pinna of his ear, I'm just going to pull on that gently. Does that hurt at all? I'm just going to assess the mastoid and the pre-auricle area, and there's no puffiness, there's no edema or redness, pain or tenderness, and I'll do the same on the other side here. Excellent. Does that hurt you at all, Patrick? No. So now what I'd like to do is take a look in your ear to look at your tympanic membrane, your eardrum. Make sure that all the internal structures are healthy, okay? In order to do that, I'm going to lift up and pull back. Insert the speculum. Please let me know if anything is painful to you. I can see quite a bit of cerumen. The external canal is clear, no redness or drainage at all. The cilia is intact. I can see a pearly, grayish tympanic membrane with a cone of light that appears to be about 7 o'clock, and the internal ear structures are intact. Patrick, I'm going to do the same thing to your right ear. Up and in again. Quite a bit of cerumen. Tympanic membrane is certainly clear. Cone of light appears to be about 5 o'clock. And this one is a little less clear. The next thing we're going to do, Patrick, is just take a peek at your mouth, at tongue, throat. Your lips are symmetric. You don't appear to have any lesions, any kind of herpetic issues, no cracks or breakdowns to your lips. Can you open your mouth wide for me? Stick your tongue out, say ah. And I want you to show me your teeth. Nice dentation. Any problems with your teeth at all? Okay, what I'm going to do is just I'm going to use a tongue blade to look around at your cheeks and at your tongue. And the oral mucosa is nice and pink and moist, clear. There's no lesions. There's no deviation from what looks standard to me. I'm going to take a look at your tongue. If you can stick your tongue out for me, Patrick, and I want you to put your tongue that way, and I want to visualize your tongue. And that looks great. Can we do it on the other side? And again, that looks great. No sores. Can you lift your tongue up so I can see underneath? Excellent. If you can stick your tongue out for me, and uvula is midline. You don't have tonsils. Clear, no lesions. How does your throat feel?
Fine.
Feels fine. Okay, good. That's excellent. Look good so far, Pat. Last thing I'm going to do is use the tuning fork to test your hearing and the conduction. I'm just going to put this on top of your head. Tell me if you can hear it equally in both ears or not.
Yeah.
Both sides?
Yeah.
Okay. Tell me when you're done.
Done.
Okay. And then I'm going to do behind your ear. This is going to be on your mastoid. Tell me if you can hear it.
Yep.
Tell me when it stops.
Now.
Can you hear it?
Yep.
Tell me when it stops.
Stopped.
Okay. Let's do it again. This is called the Rhine test. The one on top of your head was called the Weber test. Tell me when.
Stop.
You hear it?
Yep. Stop.
Okay. Patrick, I'm going to stand over here on this side of you. I'm going to have you occlude this ear with your finger. And what I want you to do is plug this ear, and I'm going to say a word to you, and I want you to repeat it back to me. Baseball.
Baseball.
Okay? Occlude the other ear. I'm going to come over here. Apple.
Apple.
Okay, great. Sounds like your hearing is good. No pun intended. Thanks for your time. Did a great job, buddy.